Have you ever seen a butterfly rash, also known as a malar rash? I have, plenty of times. My name's Dr. Anthony Wheeler, and I'm going to teach you everything that you need to know about pathology. Especially this image today, right? Because we're talking about autoimmune disorders. Make sure you have the book, Medical School Pathology and Step 1 Review. Check out the website Pathology. There you'll find additional resources, all curated and tailored specifically to make sure you do the best that you can on Step 1 in medical school pathology. Have that strong foundation, right, so that you win. Autoimmune disorders. These are characterized by tissue damage caused by the immune system. In the United States, the prevalence of autoimmune disorders is approximately 1%. Autoimmune disorders involve losing tolerance for oneself. It's kind of like that annoying ex that you have. You know, you lost tolerance for them, but except it's towards oneself, right? Just kidding. I'm funny. Although self-reactive lymphocytes are regularly produced, they undergo apoptosis, or negative selection, in the thymus, right? That's for T cells, or bone marrow for B cells. Or they become anergic because of the recognition of an antigen in peripheral lymphoid tissues with no second signal. Autoimmune disorders typically affect women more than men. And it's usually women in childbearing age. In people who have a genetic predisposition to autoimmune disorders, the etiology is probably an environmental trigger. For example, increased incidence in twins and associated with certain HLA subtypes. This is very important. There's some key autoimmune disorders to be aware of for your medical career, for pathology exams, for Step 1 exam, right? You need to definitely know about systemic lupus erythematosus from here on out. If you don't know, now you know. It always shows up. Antiphospholipid antibody syndrome, Sjögren syndrome, scleroderma, CREST Syndrome, and mixed connective tissue disease. You have to know all of these, but you do know all of these. So let's hammer down some key points. Regarding autoimmune disorders, you don't have to know this image or read any of this text. Just take away that there's an adaptive immunity and then there's the innate immunity. We talked about that in a prior presentation. You can check that out, rehash it. Let's move on to SLE, systemic lupus erythematosus. Systemic lupus erythematosus is a systemic autoimmune disease. Multiple tissues are damaged by antibodies against the host through type 1, or antigen antibody complex, and type 2, which is cytotoxic, hypersensitivity. Systemic lupus erythematosus, like many autoimmune conditions, typically affects females more, especially females of African American descent. Now here's this image again. Make sure you pay very close attention. You can recognize the butterfly rash, right? You're going to see this again, I guarantee it. Systemic lupus erythematosus has some key features, such as fever, weight loss, this classical malar butterfly rash, especially after being in the sun, arthritis, renal damage, pleuritis, and pericarditis even, due to the involvement of serosal surfaces. Might even see CNS psychosis, right? This is a big deal. Regarding systemic lupus erythematosus, it's the most frequent type of renal damage is diffuse proliferative glomerulonephritis, while other injury patterns can also occur. Might also see endocarditis, myocarditis, or pericarditis. because it may affect any layer of the heart. You might see non-infectious or sterile vegetations on the heart valves. They may be present on both sides of the valve, causing Libman-Sacks endocarditis. Also with SLE, we can see leukopenia, thrombocytopenia, or anemia, right? You know what those words mean. Low white blood cell count, low platelets, low hemoglobin, and red blood cells for the most part, because of autoantibodies against cell surface proteins. Wow. It's even impacting the cellular level. Regarding some lab values associated with SLE, definitely be on the lookout for anti-nuclear antibody, right? Now that is sensitive, but it's not specific. If you want to be specific, use anti-double-stranded DNA antibodies, right? Because that's highly specific for SLE. Drug-induced systemic lupus erythematosus is characterized by anti-histone antibodies. Common causes of drug-induced systemic lupus erythematosus include hydralazine, procainamide, and isoniazid. Remission of drug-induced systemic lupus erythematosus frequently follows drug withdrawal, okay? Infection and renal failure are the usual causes of death in SLE. Infection and renal failure, right? Let's talk about antiphospholipid syndrome. Antiphospholipid syndrome and systemic lupus erythematosus are related in 30% of cases. So oftentimes you'll come across a clinical vignette saying, a female patient, pregnant, there's certain VQ mismatch issues. It's likely due to antiphospholipid syndrome. It's characterized by the presence of autoantibodies against phospholipid-bound proteins. The two most prevalent antibodies are anti-cardiolipin antibody, which interestingly causes false positive syphilis tests, right? What really causes syphilis? Treponema palladium, right? Also, regarding antiphospholipid syndrome, antibody that you need to be aware of is lupus anticoagulants, which falsely elevates the PTT lab values. Antiphospholipid syndrome leads to arterial and venous thrombosis, including deep venous thrombosis, DVTs, hepatic vein thrombosis, placental thrombosis, which can lead to repeated pregnancy loss, unfortunately, as well as stroke. So for antiphospholipid syndrome, lifelong anticoagulation is needed. This image here to the right is showing mucoid intimal hyperplasia of a medium-sized artery, right? Because antiphospholipid syndrome can affect the arteries, causing the obstruction, and that's what we have here. Well, let's talk a bit about some key insights for Sjögren's syndrome. Sjögren syndrome is the autoimmune destruction of lacrimal and salivary glands. See, I know some of my students have Sjögren's syndromes because when I give them lectures, they're very painful. They want to cry, but they can't because they have Sjögren's syndromes. Their eyes don't tear up. They just have to listen to me. Sucks for them. Just kidding. They're probably learning a lot if they pay attention. Anyhow, fibrosis coupled with lymphocyte-mediated injury occurs in the Sjögren syndrome, which is due to a type 4 hypersensitivity reaction. Oh, did I mention that Sjögren syndrome is the autoimmune destruction of the lacrimal and salivary glands? So your key sort of clinical feature that you'll see, it'll be an older lady. She'll have dry eyes. She'll have a dry mouth and recurring dental caries. Specifically, keratoconjunctivitis, xerostomia, and recurring dental caries, right? It's usually an older female, 50 to 60 years old. Symptoms of Sjögren syndrome typically include dry eyes, dry mouth, trouble swallowing. Why? Because those glands that would be lubricating these areas or producing liquids are being attacked and are unable to produce the compounds that the glands would normally produce. ANA and anti-ribonucleoprotein antibodies like anti-SSA and Rho and anti-SSB or La are the defining features of antibodies for Sjögren syndrome, right? So you need those labs. ANA and anti-ribonucleoprotein antibodies, anti-SSA and Rho and anti-SSB and La are the defining features. I put it there twice so you know. So you do not confuse it with SLE. This is Sjögren's syndrome. For SLE, specifically, you want those anti-DNAs. For Sjögren's, you want the anti-Rho, anti-La, okay? I put it twice on purpose so that you know. And you do know. You'll never forget. There's frequently linked to other autoimmune diseases, especially rheumatoid arthritis, right? So if you're a future budding rheumatologist, keep in mind Sjögren syndromes for those female patients with autoimmune conditions complaining about their knee ache. Now, what's scleroderma? Scleroderma is an autoimmune tissue injury accompanied by fibroblast activation and collagen deposition or fibrosis. Scleroderma is broken down into two types, whether diffuse, systemic, or localized, one region, one organ, right? The skin and early visceral involvement are signs of the diffuse type of scleroderma. And there is an increased chance of developing B-cell lymphoma, specifically marginal zone lymphoma, which occurs late in the course of scleroderma and manifests as unilateral enlargement of the parotid gland in some cases. Almost any organ can be damaged in scleroderma. The esophagus is frequently impacted, leading to irregular motility, such as dysphagia for solids and liquids. ANA and anti-DNA topoisomerase 1, or SCL70 antibody, are the defining features. Here we have an image of a patient with scleroderma. Check out their hands. You see the features of their skin. Local skin and late visceral involvement are exhibited in the local type of scleroderma. And here we have an image of CREST syndrome. The CREST syndrome involves calcinosis cutis, Raynaud syndrome, esophageal dysmotility, sclerodactyly, and telangiectasias. With regards to mixed connective tissue disease is an autoimmune mediated tissue damage with mixed characteristics of SLE, systemic sclerosis, and polymyositis. In mixed connective tissue disease, serum antibodies against UI ribonucleoprotein are the defining features. And with that, we'll close out. Make sure you know what a malar rash is. Make sure you understood all those conditions, because you will highly likely be asked about them in the future several times. They show up on lots of various things, okay? But you know them, you saw them, you just saw all of them, you got it down, right? You took notes, you remember in your mind, you let those images sink in. You got this. You're going to do great. Keep studying. Make sure you have the book. If you don't have the book, why don't you have the book? You need it. Don't waste time. Don't procrastinate. See, the thing about procrastination is that oftentimes the first step is the hardest. Make that step. Take action. Do what you need to do to succeed. Right? You got this. I believe in you. You're going to do great. Keep studying. Revisit what you don't know, right? Work on your weaknesses, right? Keep your strengths up, and I'll see you later.